Jiayuan Feng from the BBC Chinese service. Thomas Friedman is the president of Resolve to Save Lives, which focuses on preventing epidemics. He's also former director of the Centres to Prevent Disease Control. He explained to me how this coronavirus differs to the one that produced the outbreak of SARS in 2003.
This is a novel coronavirus. The genome was just released several weeks ago, and there's still a lot we don't know. The two main things we need to understand are how infectious is it and how deadly is it. And for those two things, we're going to need a lot more of the epidemiology, a lot more to tell us what the patterns are. Healthcare workers have become infected. How did that occur? Patients have died. How many have become infected? We know the number of cases that have been reported, but how many have been tested? How many contacts are positive for each case? There's so much we don't know. At this point, there are only a few things that we can say for certain. One of them is that it is a newly recognized virus. We've never known this virus before. Second is that it is causing severe illness and death. The third is that it is spreading from person to person. So those are not good things, but we don't yet know how severe it is. And for that reason, precautionary measures are quite important, protection of healthcare workers, quite important, and learning more as quickly as possible and sharing that information openly, also critically important.
Just reading your latest piece, you make it clear that on what the World Health Organization has already indicated, there are strong suggestions this virus could potentially spread widely and for a long time. Do you feel the measures that need to be taken are being taken?
At this point, there are several things that need to happen. Widespread testing of people at risk in Wuhan and other areas of China, which may have been exposed. Careful protection of healthcare workers, because both SARS and MERS, another coronavirus, spread widely in healthcare facilities. And finding out more about why this is spreading, what the risk factors are, so we can reduce that risk.
Make the point, I know it's a quote, that we are outnumbered by microbes by billions to one. It's their numbers against however smart we can be. There are quite simple, though, infection control strategies that I think a lot of us don't necessarily think of.
One of the things that's not done nearly enough is to wash your hands. Hand washing is very effective at reducing a wide variety of viral and some bacterial infections. So washing your hands every time before you eat, regularly throughout the day, anytime after you've gone to the bathroom, is very important and really cuts down everything from school absenteeism to the risk of serious illness. In addition, cough hygiene, so covering your mouth and nose when you cough or sneeze with a tissue or with your sleeve, preferably not with your hand, is a good way to reduce the spread of infection. In many parts of Asia, people who are not feeling well wear face masks. And some very rigorous studies that we've done in the US suggest that that's moderately effective at reducing the risk to other people.
Thomas Friedman, who's former director of the Centres for Disease Control.